Yeah.
So genetic testing has always been very, very tricky and always been kind of the linchpin or really the bottleneck of getting information. So the company that does Luxturna is Spark Therapeutics. And in trying to increase their pipeline of gene therapies, they are now providing free genetic testing on a very wide panel. It's over 300 genes now. So I have found that that is the easiest way. Spark will provide these kits. They do 3 different kits. They do blood samples, sputum, and a buccal swab. So it's very easy to get genetic data, even in the office, and they will provide it, I believe, to any physician who asks for it. So that has been my preferred way, and it's completely free. The other thing is that once they find, if they get a positive read on the affected patient, everybody in the family can get tested for that same mutation for free as well. So that to me is the most streamlined approach, and there's pretty quick turnaround with that. The more traditional approaches are a little bit more difficult because they usually require working with a primary care provider, your insurance companies, finding out which genetic screening companies they'll work with. But those are, it's easier than it has been because of the Spark option right now, but it's still more difficult, honestly, than it should be to get genetic testing.
Dr. Drenser, I think it may be informative for the audience if you would to explain the difference between the sort of testing that Spark is offering for identified mutations as opposed to genetic sequencing. Do you mind doing a 30-second tutorial on that?
Absolutely. So genetics testing has gotten very, very, very sophisticated as well and very confusing. So traditionally, you would do direct gene sequencing. So you would say, I think it's this gene, and it would go out and they would just sequence that whole gene. Then we got into panel sequencing, which is a little bit more analogous to what Spark does, which is that they have 300 genes, but they're not necessarily direct sequencing the whole gene of every gene. They are actually targeting the most common mutations that are affected and have been reported. Now, that being said, the technology is robust enough that they actually sometimes do come up with new novel mutations as well, because it's not targeted, it's kind of fragmented is, I guess, the better way to think of it. And then what's become much more popular, but actually harder to interpret, and I think this is where people get into trouble, is whole genomic sequencing, or what they call WES, whole exome sequencing. So you can do the entire human genome per person, but it's a lot of information. And so people tend to get a lot of information, which if you're not sure which genes are the most impacted in your particular disease or difficulty or symptom, you get a lot of extraneous information. So I'm always careful to warn people about not going down the whole genome sequencing, because I think you get more information than you can ever deal with. And those are kind of the different ways. If there's any confusion, I think a lot of times working with your ophthalmologist, pediatric ophthalmologist, general ophthalmologist, or retina specialist to get their interpretation and what genes they think are most likely will help direct that. And then if they can do the Spark testing, it's the most straightforward. If it's something that's not in that panel, then oftentimes I will work with the pediatrician or the primary care doctor to find out what the most seamless way is to get that done.
Thank you.